So now we have part 2 of our Quantum Entwinement Subspace Prayer Program. How to become a therapist counselor. How to be able to see patients build a business. You're working through subspace, and since you're working through subspace, you're going to have to learn about building your own energy, your own chi, your own forceful energy. Meditation, Tai Chi, all different types of exercises, martial arts, can all bring about an awakening of the Kundalini. We have several different Kundalini videos and all different types of things that help build your energy and power, to build it internally within. Now, as you recognize that we're working through the collective unconsciousness, God principle, there's a type of religious connection here. We try to downplay it. And of course, since you're not using the harness, you're doing that quantum entwinement subspace prayer therapy, and you need to start to develop that chi within. This is an excerpt from a video that helps to build your healing hands. The ability of our energy as human beings to direct our chi to heal, to be able to understand that the healing force comes within. And it's not of a true electric nature. It's kind of electric. It's not of a true chemical nature. It's kind of chemical. This prana, this connectivity, comes from a connection of the all in the universe. And as we start to recognize the power that we have within, the family, the body, the society, the very nature of the planet, as we harmonize with the nature and start to connect to all things, we can recognize that from the source of all things, the infinity, to the power of infinity, expressed within us, there is power. And we start to build this so that we can then transfer this, even through subspace. The more power we have, the more chi, the more we can extend to others. And with informed consent, we have to have informed consent. You see, our patients need to sign on that they presently seek counsel, advice, spiritual opinions, spiritual counseling, lifestyle inventory, very important. We're going to look at their life, their behavior, life advice, spiritual energy transfer is what we're giving them. Empathic, asculpian. Asculp was the god of curing and healing. And this is a better word than using healing. Compassion, happiness, wellness training. All of these things that we are going to be offering to give to them. Because it's very important that as we build their confidence, we have confidence in ourselves, that we get our education properly through Immune. We start to learn about this. Everybody then has to sign off on the wellness consultation waiver contract. This is the informed consent. You can read over these things at different times, but you start to recognize that then this is there to protect you. And recognize that the practice of medicine is diagnosing a disease and treating a disease. That's the practice of medicine. As QESP therapists, we do not diagnose disease. We discuss lifestyle. We discuss symptoms, and we're not to diagnose. We discuss what the patient wants different. What's causing them suffering by them wanting things different? We find the health and the wellness in our client and increase that health, increase that wellness. We're not diagnosing disease and reducing it. We are diagnosing health and wellness and increasing it. That is not the practice of medicine. That's the practice of spiritual counseling. And we're going to tap into that spiritualness. It borders on religion, and we need to be akin to religion, but we have to recognize we are teaching people. That's what eductor stood for. That's the word doctor. And we are really teaching people how to live and how to eat, exercise, meditate. That's what we should be doing. As we learn more and more about ourselves and how to help others, we teach that to other people. We have to keep our data confidential. There's HIPAA Act and the Health Insurance Portability Accountability Act. We have to keep everything we do confidential. You don't share this. All records, all communication, confidential. Protect it in 1,000 ways. Teach the patient how to do some nice breathing exercises. The alternate nostril, the diaphragm breathing, the cerebral spinal fluid. We have videos on this to help teach that. Very simple little technique to get your patient harmonized, opening up. And then we start into the lifestyle inventory, finding out what is suppressing and obstructing their cure by asking them questions about the synthetic drugs they're taking, the cigarettes they smoke, organs removed, the amount of coffee, alcohol, these type of things, the stress they're under, the amount of exercise. So we start to find out what is it in their lifestyle that needs to be corrected. This is very important for us to be able to deal with. Very important for us to be able to help our patients to recognize, because we have our SOC index. This is the heart of our inventory. You spend a little time on this, not too much. Spend a couple minutes, because this is the educative part that helps to awaken them as to what in their lives they might be doing wrong. When we find out the causes of disease and reduce them, patients get better. We do not have to diagnose all disease. Diagnosis is not needed to heal people. Just asking people to drink more water can help. We don't have to diagnose. Now, inside, if we go to the risk profile then, after having done the SOC and then doing the test, we go to the risk profile. Down on the bottom, you see the button, Symptom Inventory. Now we can go to a symptom inventory, and here we start to ask about the symptoms, but we do not lead them in questions about the symptoms. We ask them just to tell us what their symptoms are, okay? What they think their disease is. You do not diagnose by asking symptoms. You diagnose by taking a pattern of symptoms and coming up with a syndrome or a diagnosis. Do not do that. Resist. It's not needed. It's not accurate. But by doing this in the system, you're now going to be doing perfect homeopathy, because the machine will now direct the perfect homeopathic. Do not lead them in questions. Learn to ask questions and get your answers, but do not lead them in such a way. Now let's look at a bad example of how people can lead somebody into questions. So let's take a look at what not to do in asking a question.
Now, where does this thing go? Hello, this is Dr. Bennett. How can I help you?
Hello, Dr. Bennett. This is Anna.
Oh, hi Anna. How can I help you?
I think I'm sick.
Let me ask you a couple of questions. Do you have a sore throat?
Yes, I have a sore throat.
This is very wrong. The stupid medical doctor is asking a leading question. You don't ask, do you have a sore throat? You say, describe to me the situation and conditions of your throat. How do you feel?
Do you have a cough?
Yes, I have a cough.
Now you see, that's a bad question. Do you have a cough? You're planting the subliminal idea. When you have the patient say, what's wrong with you? You're planting the idea that something's wrong with them. You're making a suggestion. This is the improper way to do medicine. Now we don't do any leading questions, okay? We want to just ask questions that tell us about symptoms, pains, etc., but we don't want to relate them because we don't want to diagnose. We especially don't want to go onto the internet and ask these type of symptom questions.
Never Google your symptoms. That is my only prescription. You get 100 diagnoses, a medieval prognosis. Every sign is a serious condition. If you Google cough and diagnosis, you have got tuberculosis. And if you Google fever and red, you've got Ebola and soon will be dead. And if you Google I have a runny nose, it's CSF, your brain is leaking juice. And if you Google itch and prognosis, anaphylactic shock or psychosis. Never Google your symptoms. Seldom it brings any wisdom. You want to discover, but you might uncover that you have an extra chromosome.
The next part in our spiritual counseling is to basically be able to go over a question, what are you suffering about? What causes you suffering? Why aren't you happy? What do you need different? What do you want different? You see, life is suffering. There is suffering. Old age, it happens. This is just the reality. The Buddha saw that. And the cause of suffering is the desire to have things different. If we could change the things that we can and accept the things that we can't change, then we can start to learn. So we start to explore this. We have different videos that go into this in much more depth. Then you have to recognize we're going to use bibliotherapy. We're going to give people books on natural medicine that will help them. You're not treating the disease. They can learn about how to help themselves from bibliotherapy. Okay? It's very, very important. You're going to give them natural medicine. Then we're going to tell them that pharma comes from the word poison from a witch. That's what a pharmaceutical. We're going to start using electroceuticals. We're going to teach them how to use natural medicine, how to use different electroceuticals, how they can make that as a choice for themselves. We're going to help them to do that, and they'll be able to take these things and work on their own telephone and be able to get their electroceuticals to help them with all the different types of things from depression, immunity, and all these other things that we're going to be helping them to deal with. We're going to also be teaching them about nutrition, the benefits of whole food, how they need to get whole plant food to get all the different fiber, and that fiber will create the chemicals in their brain that they need. So as we start to teach these people more and more about a natural way, akin to a spiritual way, because nature, God consciousness, it's hard to describe one without the other. And that's what we're going to be doing, working on energy transfer, and helping patients to do this. Now here's a couple of other little tips on how to set up your interview online through the web.
Hi, I'm Dr. Tanya Elliott. As some of you may know, I've seen over 7,000 patients through video visits, and so I'd like to think that I've started to nail down the key aspects of having exceptional website manner when I interact with patients. So this takes some practice and getting used to, and I've taken a lot of patient feedback in and trained a lot of doctors on how to have exceptional communication skills through this modality of video consultation. First things first, in terms of setting up an appropriate background and setting the stage for professionalism. However you dress, whatever your professional dress is for the office, whether you wear a dress, a shirt and tie, if you wear scrubs, do the same thing for the video consultation. In terms of a background, you can have a white wall that's perfectly fine. It might be a little bit bleak, so you may want to put a painting up behind that or perhaps a bookshelf. That's perfectly fine as well. One thing you don't want to do is be directly in front of a door. Studies have shown that when patient sees a door directly behind the practitioner, they feel a sensation that the doctor wants to turn around and leave right away. And so you want to avoid being directly behind a door. It's okay to have a doorway way in your background like I do, but you don't want to be directly in front of a door. Also, making sure that your face is perfectly framed up within the middle of the camera. You don't want to be like this, talking to the patient. You don't want to be like this, talking to the patient. You don't want to be over here. You don't want to be over here. So making sure that you're the appropriate distance. Right now, I'm approximately 2 feet away from the camera. So again, making sure your face is framed and doing a video test beforehand so that the patient doesn't have to wait while you properly position the camera. The next aspect is eye contact, and this can be really challenging because when you're talking with a patient through video, you want to be looking directly at the patient. So right now, I'm looking, quote, directly at the patient. I'm looking directly at myself. However, I'm not making eye contact with them. I was not making eye contact with them. I actually have to look directly at the lens of the camera in order to make eye contact with the patient. So it's a little bit counterintuitive. Our eyes often shift to either look at ourselves or to look at the patient directly, but the patient isn't perceiving that you're looking at them directly. So make sure that your eyes are parallel to the lens of the camera. That's how you make eye contact through a video visit. And it makes a big difference. Your eyes, your facial expressions, all of those things are more exaggerated when you're on film, when you're on camera. So just make sure that you have nice, warm, kind eyes. You're looking directly at them, and by directly at them, I mean looking directly at your camera and initiating the consultation that way. Another thing that helps set the stage for a video consultation is to ask their permission, to ask their consent. So if it's a new patient, you introduce yourself. Hi, I'm Dr. Elliott. It's nice to meet you. And then the next section is, do I have your permission to treat you through this video consultation? Setting that up is tremendously important because both for the doctor and the patient, this entire encounter is new. And so you want to make sure that you frame it up with the same level of respect and professionalism that a patient experiences when they walk into your office. Okay, so we've checked off background, dress and professionalism, how to frame up the camera, and then we've started to talk a little bit about communication skills. So making eye contact with the camera, again, tremendously important. And then making sure you're keeping your facial expressions in check. Remember, everything is exaggerated on camera. So you may be scowling, you may be making a certain face, you may be looking away, and all of those things are exaggerated when you're on video. So just keep that in mind. Now, oftentimes when you're doing a Zoom or a FaceTime or any video modality, you actually have a little cheat sheet that you might not have been aware of, and that's your face in the upper or lower right or left-hand corner. So every now and then, while you're doing the encounter, glance over at your face, just give it a bit of a reality check, make sure you're not making any funky facial expressions, and leverage the fact that you can see yourself and get real-time feedback during the encounter. It's tremendously helpful as you continue to hone your website manner skills. The next thing that's very important is your clinical documentation and at what point you do that during the encounter. If you decide that you want to do documentation while you're interacting with the patient, that's perfectly fine, but let them know that you're going to be typing while you're interacting with them. So I'll often say to the patient, you may hear me typing right now, and that's because I want to make sure I get down every detail of what you're explaining to me. The reason that's important is the patient can hear you typing. So if you're going and clicking while the patient is talking and you're clicking and clacking on your computer, it could be very distracting to the patient. But if you let them know up front and you set those expectations up front, it oftentimes is perfectly fine. Or the patient may say, oh, I prefer that you don't because it's distracting to me, which is okay as well. But again, setting those expectations up front is very important.
Now, whether you make a report or not, that's up to you. I think you should be making reports. Patients will enjoy that. There's no reason to not make a report as long as you watch your wording and do it right as you learn more and more. If you have any questions at any time and you want to run a report by that you might have a problem with, you can send it to me and I'll take a quick look at it for you. But try to keep in mind, you're not diagnosing, don't use those words. You're not treating diseases, don't use those disease words. You're helping symptoms, you could be doing this, and you could be helping people with spiritual. Now, as you get more and more into the spiritual path, you can do more and more questioning. There's nothing wrong with eventually asking temperature, blood pressure, these type of questions. You can ask these things. As long as you're keeping it in the context of your scope of practice, which is as a QESP therapist, trying to work with that energy healing response and increasing wellness, not decreasing disease. Now, our friend the doctor now is going to tell you a little bit more about going deeper. And I caution you, do not start with this type of thing. Do not do this type of deep work immediately. Be very, very careful and learn to do this gradually as you build more and more confidence. This can be dangerous.
So it was William Osler that said that medicine is all about the art of observation. So the first thing I do after I connect with the patient and consent them to do the video consultation is evaluate their general appearance. Are they ill appearing? Do they have pallor? Are they diaphoretic? Are they flushed? Then if I feel like I need vital signs, I ask them if they have a thermometer at home and just to go ahead and take their temperature to show me what the reading is, and then I can document what the result is. Some patients also have a home blood pressure cuff, so that's another thing I'll ask them to go ahead and get to take their blood pressure and pulse if it's relevant. If patients don't have one and there's somebody that you see chronically and you'd like to have that as a regular vital sign, you can just ask them to go ahead and pick up a straightforward blood pressure cuff and then show you the result on the reading, and you can document that. Respiratory rate is something that you can calculate as the patient is speaking with you. Now, the other piece is having multiple windows open. So some doctors will have 2 computer screens up and they're looking back and forth between the 2 screens. And some doctors have multiple tabs up, so they can be typing and talking with the patient and then looking away because they're looking at another tab on their computer screen. Again, it's perfectly fine to do that and to look away and even look up something while you're on the consult with the patient, as long as you let them know. So I will let my patients know. Just want to make you aware that I have 2 computer screens up right now. So if you see my eyes darting away, it's because I have your patient record on one side, and that's what I'm looking at when you see my eyes move over here. And then of course I want to make sure that I make eye contact with you. So letting your patients know that, or letting them know that perhaps you're looking up the most recent guidelines, all of those things are completely appropriate, well received by patients. You just want to let them know that you're doing that up front. Again, all these nuanced things that are slightly different through video, so you want to just go through this journey together with the patient and set those expectations up front. Now, I've talked a lot about physical examination and how to frame up the visit. And so just to do a bit of a recap, you want to set up the conversation, obtain consent from the patient, ask open-ended questions to have them tell you about what's going on and the history of present illness, and if they're a new patient, past medical history, medications, allergies. Oftentimes video encounters will be much more consolidated than an office visit because they're very efficient. You're making direct eye contact with the patient and both of you are getting to the point. So you get that history of present illness, and then you do the appropriate aspects of a physical examination. And in order to be effective at that, your patient has to be a partner with you on that journey. Talk them through each aspect of a physical exam. If you're going to be evaluating the sinuses, let them know up front. We're going to do the sinus evaluation now. Here's what I need you to do. Then we're going to move on to the respiratory exam. Here's what I need you to do. And setting those expectations along the way enables you to get the objective information that you need in order to conduct a successful visit. The last piece of a video visit is to sum up everything that has occurred. So, patient, based on your history of what you told me, as well as the aspects of a physical exam, here's what I think is going on. And with a telemedicine visit, we may not be able to make the complete diagnosis. We may have next steps that are recommended, whether it's to get a lab test, or perhaps it's a higher level of care or higher level of acuity. And all that's perfectly fine. But after you go through this journey with the patient, getting that intake, getting those objective measures of the physical examination, now it's time for the shared decision making and making that plan and conveying that information to the patient. The last thing I do for my patients is I write down everything that I've discussed in the form of patient instructions that I then email over to them through their patient portal. And patients find this very valuable because all of this is new for them and they're struggling to remember everything you say. And we know that patients typically only remember about 10% of what we tell them in the office. So let them know that you're going to be writing up instructions for them that have reviewed next steps and all of the things that you have discussed during the encounter so that they feel confident that they know what to do next. That's all for now. Thanks for watching.
I'm supposed
Now
to be doing a
some
televideo
don'ts.
at
What not to do.
2 o'clock. It's like 6 minutes after, and it's to Mariposa. I'm not even sure exactly where they are, but I can tell you that they are always late. That's the one thing I know as to where they are. So I don't know. I may bail after another 5. Yeah.
Dr. Goldblum, actually
Yeah.
Mariposa can see you. You're on their camera and they can hear you.
Hi, Dr. Goldblum here. You must be Ken. No, you must be Phil. Hi, Phil. I'm Dr. David Goldblum, and I'm your consultant today on televideo. Can you hear me? Can you see me? I'm right here. Right? You got it? Okay, good. Okay, let's get going. Okay. So Phil, before we get started, let me explain a little bit about confidentiality. First of all, this is a secure transmission line, and what we're about to discuss is entirely confidential, with almost no exceptions, unless there's a danger to
I forgot to clear up.
Oh, hi, Superneat. How you doing?
Sorry about that. I'll let you continue.
Oh, no problem. Great to see you. Gee, I feel like we need to get caught up. Anyway, so it's completely confidential. And Superneat, sorry, but I think you forgot this. This is yours. I'm pretty sure that this is yours. So be sure to take that with you, okay?
Thanks.
Great to see you. All right, I got to get back to work. Right. Well, look, Phil. Let me try to summarize for you what I think is going on in what you've told me. Ever since that incident in the coal mine, you've been struggling with a depression. I think that has not been adequately diagnosed, or treated. So I think what we need to do is think about a treatment plan that could help you to... just sit tight for 1 second. Dr. Goldblum? Yeah, I'm kind of in the middle of something. Well, I obviously can't see the car when it's up on the hoist, so you tell me if the tires look bad. You know, I got them last season. Look, I'm in the middle of something quite important, okay? I'll call you back. Thank you very much. Sorry.
Hello there, I'm Dr. David Goldblum. You may be going through your first experience with televideo, and I want to welcome you to the new technology. Just as long as you can see me clearly, then it's going to be as if I'm right here in the office with you. I heard you were having a little trouble seeing me before, but I hope that this way you get a better sense at least of what I look like and how I'm reacting to what it is you're telling me.
Hi there. Are you Penelope Waters?
Yes.
Hi, I'm Dr. Allison Crawford. I'm the psychiatrist who's going to be speaking with you today. Nice to meet you. I just want to tell you, I understand this is your first time meeting with somebody by televideo, so I just want to explain a few things about the process. One of the first things we do is always make sure that we're speaking to the right person. So you're Penelope Waters?
Yes.
And can you just confirm your date of birth for me?
Yes. September 17th, 1976.
Okay, great. Well, it's a pleasure to speak with you. We always make sure that people understand that although I'm speaking to you by camera, nothing's being recorded right now. And this is just as confidential as if you were in my office with me. So there's no one else in the office with me, and we make sure that no one else can hear what we're speaking about.
Excellent.
Okay, and at the end of our session, I'll be sending a note to your doctor.
Okay, great.
Okay. I also, you might see me, I have a remote control here, which allows me to zoom in and out. And you have the same thing there. So if there's something that's not clear to you, or you want to zoom in on me or zoom out, then you can do that with the remote control.
Okay.
Okay, great. Do you have any questions?
No.
Okay, and if at any point you get upset or you need anything, you can always go back and speak with the nurse who brought you into the room. Okay, we can pause at any time.
Okay, thanks.
Great, well, let's get started. Can you tell me a bit about yourself, like what town you're in, who you live with?
Yeah, I'm from Mariposa, and right now I'm living with my sister.
Okay, great. And are you working right now?
Yeah.
As you're working with this energy, you have to recognize that you are working with health. You're trying to increase it. You're not trying to decrease disease. You're trying to increase health, but you are working with health care. Most of the medical doctors are working with disease care. They are concerned with disease and they are caring about disease, whereas we care about health. So we are still health care practitioners, healthcare workers. We need to network with our brethren, whoever they may be. We try to network. We try not to work against them. Oftentimes we're going to be butting heads about whether we should be using medication, yes or no. Recognize that Ecclesiastes 3, a spiritual part of the Bible, tells us there's a time for all things under heaven. There's a time for love, a time for war, a time to tear things down, a time to build things up. And there's a time for medication. There's a time for no medication. There's a time for natural. There's a time for the synthetic. But it should be a very little time for the synthetic. Recognize to refer doctors and people at every step. Try to work with your doctor and work together, recognizing you do not diagnose. You are working with natural energy, empathy.
This is what I heard my father say, and then he closed his eyes and passed away. The autopsy report was very clear. Death from hypochondriac fear, which is custom when you Google your symptoms. Never Google your symptoms.